your mind and the rest will follow.
You start with figuring out what does health look like for me, physically, mentally, emotionally, and work really hard on being good at eating.
Healthy mind, healthy body, healthy life. Soul Food on Smooth 98.1.
Feed your mind and the rest will follow. We also feed your body and feed every aspect of you so that you are whole, you're well, and you get the best out of life. You are not at the mercy of other people, not because you don't need them, but because you are independent as a result of you being in the best shape. So welcome to Soul Food right here on Smooth 98.1. We love music, we love life, and we love a healthy you. That's why we have these discussions every Saturday from 8 till 8:30. My name is Oluwaseun Olusegun. Today, as announced earlier on our social media pages, we'll be talking about the topic of frailty and falls, the role of physiotherapy. So in there, we're going to be talking about what constitutes healthy or what healthy aging is. And we're going to talk about the role of physiotherapy itself. Many people only remember physiotherapists when there is fire on the mountain, and that shouldn't be the case. So we are going to try to help you increase the good rating of your health seeking behavior. And then we talk about frailty and falls. And when we talk about physiotherapy, I think the perfect person to have this discussion with is someone who's an expert in different aspects, especially as touching neuro rehab and geriatrics. And he's not a stranger to us at all, even though he feels like he's been on a little bit of a break, but he's back home to us. I'm talking about Adejugbabe Muyiwa Kenneth. Good morning.
Good morning, Sharon. Good morning. Good morning, listeners. I'm happy to be here. Thank you very much for having me.
It's a pleasure. Thank you for being here. Now let's get started with understanding what the role of physiotherapy in our everyday life, such that we don't have to seek for help only, or we don't have to come to the physiotherapist corner only when we have pains or something is wrong with us. What exactly is the role of the physiotherapist?
Okay, thank you very much for that question because, just on the 8th of September, we celebrated the World Physiotherapy Day. So this is a robust opportunity to actually educate people, and to let them know what physiotherapy, what physiotherapists do. So physiotherapy is a medical profession that is very much, like when it comes to maximizing and optimizing, functional independence and movement. Back then in school, we have these characteristics of living things, and we always use this acronym for that, Mr. Ninja D. M stands for movement, and that's the reason why the M is there is because movement is life. If you're not moving, if you're not, at least being able to transfer or translate from one particular point to the other, then what is the whole essence of life? So movement is actually the true essence of life. And the custodian, the professionals, is to actually, meant to protect that particular, attribute and characteristics. They are the physiotherapists. So sometimes you might actually get to hear them, oh, these are the movement experts, and because if you are moving, you're able to go about your day-to-day activities. You're able to get to the kitchen, cook something for yourself. You're able to get to the bathroom, you have your shower and everything. So when it comes to physiotherapy, it's about restoring, maintaining, and maximizing, one's, ability to move, mobility, function, and well-being. And when that is done, when your movement, everything is optimized, definitely the quality of life will be very much improved upon. So physiotherapy is, or let me say physiotherapists, that is actually what they do. And we work with the rest of the MDT, the multidisciplinary team, the doctors, the nurses, the radiographers, the medical, laboratory scientists, every one of them, we actually work closely together, in synergy to bring about that improved health outcome, for our patients. And also, as you said, physiotherapy is quite very broad, just as we have from, for the physicians and for the nurses. So we have different specialties, when it comes to physiotherapy. We have the, as you said now, neurophysiotherapy. Those are the ones that actually have to do with the neurological rehabilitation. Someone has suffered a stroke, a traumatic brain injury, a spinal cord injury, someone has maybe all these autoimmune conditions as Guillain-Barré syndrome, some quite a lot of maybe damage to the nerves. And when it comes to the orthopedic, I think people actually, you must have heard of Igbobi, National Orthopedic Hospital. You
Mhm.
have physiotherapists there. You fracture the bone, you've dislocated or subluxed a particular shoulder. You have one of these. When it comes to all of those injuries, maybe a sprain or a strain, a muscular tear, a ligamental laxity, then an orthopedic, physiotherapist or a musculoskeletal physiotherapist comes in handy. That is their own area. That is their own niche. We also have pediatric physiotherapists, for children. No, they have got delayed developmental milestone, maybe as a result of cerebral palsy, maybe as a result of spinal bifida. Then these are the people that actually help in, habilitation to get these children back to, what their peers are doing, such as crawling, standing, rolling, taking their very first step, even getting them some kind of maybe adaptive devices, that they can actually use to mobilize, from one point to the other, just to give them that improved quality of life. And we have women's health. We have physiotherapy in O&G, that's obstetrics and gynecology conditions. We have economic physiotherapy. We have industrial physiotherapy. Of course, I think the popular one that we also get to know is the sport physiotherapist.
Oh, yeah.
Yes, amongst footballers. So it's quite very much diverse and is it is actually everywhere. Apart from just maybe it's not only for patients alone, even for healthy people. You want to just, as you said, it's not just only when you become terribly ill or you are in terrible or very severe pain that you start going to the hospital or seeking a physiotherapy. So even while you are healthy, while you are very much, robust, energy, and you are doing everything, you also need a physiotherapist, whether you are healthy or you are not healthy, whether you are frail or you are as fit, as a bull. We all need a physiotherapist, at one particular point in time in our lives. So I think that's just a little bit of intro I can give
And
as regards what physiotherapy and what physiotherapists do. Yeah.
that suffices. That is really good because now I believe somebody knows that there is something for them and there is a person, at least a professional that caters and tends to wherever it is that they might be experiencing a challenge or they don't even have to wait till they experience. They can just
Exactly.
go and seek for checkup. And that's great. Now, talking about checkup and not waiting till things happen, let's talk about what healthy aging means physiotherapically. I don't know if that word exists, but I just cooked it up.
I
So in
love it. It's
terms
good.
in terms of physiotherapy, what does healthy aging look like?
Yeah, this is something that, and I think there has been in a lot of campaign, and I think the older people, a lot of people are saying that this ageism, because you see someone that is, elderly, and we just get to think that okay, they are not meant to be able to do some things and everything, and there's that is ageism, and that should be discouraged by all means. So healthy aging, and that's why I love the fact that you're even bringing this before we start talking about frailty because people actually try to, if you ask them, what is the synonyms or what are the other words for, the elderly or an aged person who will say a frail individual. No, the norm is healthy aging, whereby, you know, someone in old age, in advanced age, is able to maintain their functional ability, so that they can actually optimize their well-being and quality of life. They're able to participate in the societal, events. They are very much, you see them outside. They're able to go to the bank to do their transaction. They're able to their basic activities of daily living the the instrumental activities of daily living, they're able to, take care of their finances. They can actually get to wear their clothes. They can go to the toilet. That is healthy. So it's actually maintaining and developing the functional ability, and what is the person's ability? The person is able to meet their basic needs. The person is able to
Mm.
learn, grow, and make their own decisions. Because sometimes you will see sometimes whenever we are going, because we got some aged parents, you see the children speaking on their behalf. No, that shouldn't be. They've got the mental capacity to make their own decision and to speak. And you're not the one supposed to be the mouthpiece, And they are mobile, they can move, they can drive. That is healthy aging. They can build and they can maintain relationships. Who says that an old person or an aged person cannot stay socialized? That's where that communal integration is very important, and they can also contribute to the society. So is a Catholicon in the sense that we are looking about the activities of daily living, such as washing themselves, cooking their food, even using their mobile phones and everything. Also, they're able to go to the church, to the mosque, or to maybe their place of traditional worship. They can also do that. They can communicate, they can bond, they have, maybe their club where they go to, and most importantly, they are also mobile. They can drive, whether it's a bicycle. So that's actually healthy aging, being able to maintain and to also develop those functional ability that will make them to thrive as they advance in age. That is actually, the hallmark of healthy aging.
Beautiful explanation. And as you talked, I remember this birthday wishes and birthday greeting we often give to people when we can't think of something special for them. We'll say, Happy birthday, blah, 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 blah. I hope you age with grace or age with grace. Now, when we want to talk about healthy aging, I mean, what are the things that you do or not do? How do you make sure as an individual that maybe you're in your 20s now, 30s? How do you age with grace, healthily in terms of physiotherapy and your movement and not being at the mercy of people when you're in your 50s, 60s, 70s?
Okay, there's this. I know this is an international platform. You've got listeners in Europe, in America, and everything. But there's this thing in my language. That's Yoruba. I will try and translate to English. It says that it is what the bird has eaten. That is what it uses to fly. That's so
Yeah.
so it's just it is what you have now, because in your 20s and your 30s, this is the time to galvanize and to reinforce your body as much as possible, because this is actually the time to build your mentally, yeah, your mental resilience, your physical strength. You build the body mass, and instead of actually gathering the adipose tissues, and you are getting, instead of actually getting fat, like the fat as an adipose tissue now, this is time for you to build your muscle, because it is muscles that's actually important for movement. The skeletal muscles, the lean muscle mass, that is actually what is important. That's what contracts with your bones, that brings about moving your body from one particular spot to spot B, to another location. So this is time for you to build that lean muscle mass instead of fat. So this is time for you to build your endurance. This is time for you to build your strength, your agility. Sometimes some people have got the strength, but if you ask them, can you do this for the next 30 minutes, they get tired already. So this is time for you to build your muscular endurance, build your muscular strength, build your balance, your coordination. And that is why we, the young ones, we have to be very intentional about what we do, our own health. Because now, things, of course, with your civilization, everybody, because of the nature of our job, we are always behind the desk. We are always doing something that we're not really moving our body. And that is not actually how we are designed to be from the beginning of time. And this actually has really brought about whereby we get weaker. And you see, you are typing or you are doing something on the system, and you get to have different kind of food or snacks, and you keep snacking and you keep eating, and before you know it, you get up and you see that definitely you are getting round and round and rounder every time. So
Round.
yeah, so this is actually the time really for we the young ones. I'm also speaking to myself, because at least back there you saw me about 2 or 3 years ago. But now I'm looking. But this is time for we have to be very much intentional. And I think I love the fact that there's a kind of proliferation of these gyms, there are these gymnastics, gyms everywhere now in Lagos, especially. But I think it's also going to other parts of Nigeria. People are taking their own health seriously. But this is time for you to do your strengthening exercises. This is time for you to do all this, your coordination, your balance, proprioception, and this is time we have to be very much intentional in the sense that if you're trying to make money and you forget about your health, I can tell you that health is not cheap. That even all the money you've made, so that it will not be spent on actually now trying to optimize your health. So there must be a balance. Yes, you are in the quest of making money, of doing your job and everything. There are a lot of things that you can incorporate so that you can actually have a much more balanced, optimized health in when you get to your 50s, your 60s, and your 70s. You know, you can belong to a club, exercise club, go for swimming, some little bit of, I know some people say maybe things are not really safe, but within your compound, or you can get a small treadmill, invest in that. You can get a stationary bicycle, just some bit of cycling that we can actually get to do. This kind of little investment, I can tell you it has got a robust dividends waiting for us in the future. I know you've got other questions, so let me dwell too much on that, Shim. Yeah.
We don't mind you dwelling on it because it gives clarity and helps us to gives us the granular understanding of what you're explaining. Now, moving on to frailty and falls, I'll start with the story that somebody said or told. And the person said one time he wanted to cross a drainage, the one was called gutter. And the short story or the short version of that is the person ended inside the gutter. The longer version of it is in the person's mind, there is just a little space in between one end to the other. And when the person was growing up, this is something that you do for fun. This is, I don't know if you can, you one leg on this side, one leg on that side, and you just hop across. But somehow, I don't know if it was the mind that didn't calculate well, or the mind didn't communicate, or the leg refused the calculation of the brain. And the person thought, oh, this is small. Long story short, the person ended inside the gutter. So let's talk about falls and frailty and how these things happen, especially as we age.
Yeah. Let me just even first talk about, yes, exactly. I will try to marry both together, frailty and falls. And because I can tell you this for a fact that in the hospital that I'm working now, most of the elderly people, 65 and above, and if you see maybe about 4 or 5 of them, about three or so, they are coming as a result of falls. And of course, because maybe we are younger, we might think that, okay, oh, if you fall, then pick yourself up. But it's not always the same thing when it comes to the elderly people. And let's have some things that we need to look into and that we need to be very much, those are the clinical signs. And it can be maybe your parents, it can be your pastor, it can be your imam, it can be those, the head of the family or something that we need to take into cognizance. If someone start getting weak, they can't, maybe normally they will be able to do this. They can lift this up, but they cannot lift that particular thing. They get tired, easily. They get fatigued easily, like exhaustion. Oh, this is if that, or if grandpa walks like about, just 3 or 4 meters and he's already tired, he said he needs to sit down. Now you start thinking, okay, is this some kind of clinical signs of frailty? No, this person moves slowly. Normally their gait pattern, the cadence, the speed at which they walk, it takes them, let's say, about just an example, it takes them about 30 seconds for them to walk 10 meters, but now it's taking them, like about 2 minutes just to get from the toilet, to the living room. Now that start telling you, you should start getting worried. What is happening? What is happening to me? If you are the one that if you are the one in this situation, or what is happening to this, my uncle, or my grandfather, my grandma, and again, their balance is not really at the optimal. Any little thing, maybe maybe their grandchild or someone just drops something on the floor. If it's an uneven surface, they easily lose their balance. Another thing again is social isolation. They get depressed easily. they need assistance. Normally back then, if you want to have your bath, you can wash your legs. They can't bend down anymore, to walk to, there's a lot of flexibility, loss of flexibility in their shoulders. They can't even scrub their backs, or they can't even lift their hands to even wash their hair, or for women to wash their hair, or for men to shave. So those are the things that start giving that is this kind of this is given like frailty in a sense. And I need you to understand this. Frailty is a spectrum. We have a clinical frailty scale. You and I, we are all on that scale, and it's very easy that maybe you know like okay, let me talk about the clinical frailty scale. The very first one, number one, you are very fit. No, these are the people, they exercise regularly, they've got robust energy and everything. Number two, these people, they are well. They have no active disease condition. They get to do the activities of daily living. They go to work, they're employed, they do what they do. They don't get fatigued easily. Number three, these people are managing well. They don't exercise. The only thing they get to do is just more of like maybe they go for the early morning walks, maybe they do about 1 mile, or maybe they do about 2 or 3 kilometers. The other ones are the vulnerable ones. These are people, they are getting slowed little by little. They might actually start using maybe walking stick whenever they get tired, and what have you. The fifth one is the moderately frail ones. The moderately frail ones, now these people now start needing a bit of assistance with shopping, going outside. They cannot cross the road, as you said about this, your friend. They need some bit of someone to assist them, to prompt them to say, okay, no, oh no, mommy, you have to lift your legs higher or something if they want to cross a little bit of ditch and everything. And then we have the moderately frail. These people, they need a lot of help with housekeeping, moving the furniture, doing the cleaning of the house, trying to do some bit of cooking, even taking their medications, because there's a loss of dexterity in their fingers. They cannot pick all those tiny little bits of, pills and everything. So they need some much more support. Going to the bathroom, especially if they have to go over the bath, where they have to lift their legs, they need to be actually be very careful, because they can now, because all the body weight is now just on one leg. They will need some bit of assistance. And from there, we have the severely frail, we have the very severely frail, and then we have the terminally ill. So it's a spectrum whereby, and the thing about frailty is that the physiological reserve, because maybe if you should have a small cold, or if you have some cough and everything, you take your medications and next thing what, oh, you're back to action. But for someone that is in advanced in age and that is frail, any little bit of stressor, any little bit of, let me say, illness or injury can actually pull them downward that frailty scale. So, and that is why I was talking about that this is time for us to actually build our energy reserve, our physiological reserve, so that when these illnesses come, such as, cold, such as urinary tract infection, toilet infection, such as, someone has got some kind of hospital acquired, or let me say community acquired pneumonia and everything, you can spring back to action and everything again. And this is something that we always get to discourage amongst elderly people. We don't want them to stay in the hospital for too long, because hospital is an habitat of organisms. Like, if you are looking for the highest concentration of disease organisms and everything, some people think that, okay, you stay in the hospital is a very safe place, but where actually I am now is that we want to facilitate discharge, because we believe there's no place as when it comes to recovery, it's your home. Because now you got someone that just been got a person has got COVID. This person has got some kind of, let me say, maybe tuberculosis on the other room, even though it's actually isolated. But all these things keep flying in the air. So nosocomial infection can also even predispose someone that is yeah, it's frail. So these things can even make them even to get more frail. And oh God, time is already. I know the time is going. I'm looking at the time when you'll be able to. So and these things whereby, the weakness, the loss of grip strength, the exhaustion, and again, the appetite is reduced. They don't drink water. You say, please drink water, but they can't just, there's a kind of some problem with their swallowing. So these are the things that actually predispose them, because they get weak and all, and it can predispose them to actually having a fall. And I don't know, we talked about loss of balance and stability. Sarcopenia is a thing. Sarcopenia is like there's a loss, of the muscle mass, and these are the muscles I talked about. They are the ones that's actually holding the body together. Now, there's a mistake we always get to make, whereby some people might actually be getting fat. Where you say, oh, you say with their, with pot belly and everything. You having the adipose tissue or fat is not the same thing as actually having those, the skeletal muscle the lean body mass that actually does the actual work, of what we need to do. So that's actually some bit of, thing that we need to clarify in that kind of situation. So when someone have a fall, they can actually get to fracture their hip. And when they fracture their hip, the doctors, the orthopedic, and everything, they get to assess, and they may actually do, many of the orthopedic, surgical impute and everything. Or if it's someone that maybe fractured, the tibia or the fibula, that is the bones of the lower limb, they might put it in a cast. And they might say, okay, this person should not be bearing weight on that particular leg. This person might actually have to be on the bed, just do little things because of the cast. Now, they are not doing much anymore. So
It's
it's
worse.
a vicious cycle whereby, prolonged hospitalization and everything. So these are the things that actually it's going to even worsen the health outcome. But I don't know, maybe the next question will be that how do we as physiotherapists, how do we come in? Would that be the next question?
Well,
Or
before we get to that, I want to talk about how people can prevent or reduce the amount of falls. And one of the reasons why I want to talk about, I believe you have gotten into it, but I just wanted more lifestyle changes or
yeah,
things that could help a person prevent it. Because I know there are some people who, when they're getting to a certain age, they remodel their entire house, they remove all
fantastic.
staircases
Yeah,
and so
yeah,
on.
yeah, yeah.
So what are some of the things that adults, elderly ones can do to prevent the amount of falls once they start getting frail?
Fantastic, Sean. Fantastic. And I think you've really touched a very vital part of that. You know, it is high time that we start modeling or we start building houses to fit the individuals and not individuals trying to fit themselves into the buildings. Like you see some kind of
Indeed.
advertisement on it, like you see the stairs. Like, are you even thinking of the future at all? Now people are paying a lot of money for bungalows, to build everything should be all one level because there will be, you need to think of the future that there will be. It's not just about the illness related frailty, there's age
Mm,
related because as the body, you keeps growing and everything, your physiological reserve keeps dropping. There's some things that you can do, but you can't do anymore. And again, sometimes if you look at the hard flooring that they use, if you should have a fall, the impact, that next thing, the femur is broken, the hip is broken, the pubic ramus is fractured, they fracture their hip, even they can even fracture their neck. Like if you actually get to even see some of the stairs, it's very sharp edges. Now why can't we put carpet, like you put rug on it, to dampen the fall? At least it gives these elderly people some cushion. And you will see some stairs, there's no banisters, there's no rail on both sides. And even the one that have got rails, they are so wide apart that if you should stretch your hands, you can't even, get to the left or right. So sometimes you actually have to get, the stairs closely in, together. So at least if you're able to fall, you can use the wall, and everything to guide yourself. So, but when it starts getting to a point whereby you can't even do the stairs, the best thing I always get to advocate for is downstairs living, whereby you get to do downstairs. And and this is something we cannot all discuss on the radio. It will also be very good if you can get a physiotherapist to come to your house to do a modification, of your
excellent.
home. Get an occupational therapist because we work closely together, to come do an evaluation of your home. Look at your toilet. Is it very low? For someone that's very tall and they actually have to sit, and so it actually puts more strain and stress. Some people have got osteoporotic bones, whereby their bones are not as strong. And we know, of course, with postmenopausal women, especially with the reduction in the production of estrogen, the bones are not really as strong. So people, all they just get to say, oh, they stood from a chair, and the next thing they just add a crack on the pump. These are the things that you try to look at the chair they're sitting on. Is the hip and the knee at the right angle? Is it easy for them? Have they got armrests to push themselves up from? You look at the height of their bed. You look at, and again, even the kind of cars they drive. You don't want to get a car that they will actually have to stretch themselves. It will be very easy for them to just, get themselves and to sit there. Those are the things, a lot of modifications that we also need to look into. Another thing again, the proximity of the toilet to the bedroom, because incontinence is a thing. It's not, of course, not all aged people that have it, but for people that
Mm,
actually get to have maybe urinary or fecal incontinence, the next thing is that, okay, if the proximity of the toilet to the bedroom is, so it's easier for them to get there quickly. Or another thing is for them to get them a toilet commode which you can actually put beside their bed, whereby they can actually just, instead of actually walking a long distance. Because another thing is that when people have this frequency or urge incontinence, whereby they want to quickly pee and they cannot hold it. So the next thing is that you see them going fast, and when they actually try to increase their speed, what happens? They lost their balance, and next thing they're on the floor and they have a fall. So it's a lot of things that whereby you need to do an assessment of the home. You need to, if someone that needs a walking aid, maybe a Zimmer frame, a walking stick, and elbow crutches, you need to do an assessment for that. Other thing is about exercising. They actually, it's not just about doing YouTube exercises of kind of, these are proper exercises that it
Straight
has to be,
bullets.
yes, it has to be individualized. It's not, they need to take into cognizance your health, the comorbidities and everything. They discuss with your doctors, what is the, oh, I can see that, she was already looking at me. So,
Oh, no, no, no. Go on. Go on. Don't
okay,
worry. We
good.
can take
So,
a minute or two.
yeah, so these are the things that you look into, and the physiotherapist comes in and they can model the exercises to suit you, with some objectives. Okay, you should be able to achieve these so time. We need to strengthen your muscles. We need to improve on your flexibility, Dad. We need to improve on your flexibility, Mama. And those are the things that we work closely with the patient. It is a client-centered, a patient-centered care. And this is not just only the physiotherapy, it takes a whole village. So even the family members, because sometimes people just commit to their parents, they'll put them downstairs, put them in a room, give them their food. No, you want them to go outside. Let them get some little bit of sunshine. As I was talking about, social deconditioning is a thing whereby you separate them, maybe their friends, they are dead or they are late and everything. Get them involved in activities. Let them interact. And these are the things that we're even advocating for in Nigeria now. There should be old people's, in activity center whereby they can do, just dance and everything. Most of the things now is just towards, catering towards the younger ones. But we need to get, the aged ones included in this, because you and I, in the next 30 years, we are also going to be in this situation whereby
Oh,
we're
Lord.
getting slowed, we're going to retire, and we will need, of course, family, everybody will move on. We have to start taking and we have to start advocating for all of these. And again, the same thing into some banking facilities. They don't even have a
Facts.
ramp. Into some hospitals, they don't even have a ramp. And how do you want this elder? That's what we're talking about. This thing. We try to cut them off from the community because how will I even get there? So whether you are using a wheelchair or you are using a rollator, or whether you are using a Zimmer frame or any of these things, we should actually build an enabling environment for everybody to thrive. So this is a call to the government, a call to the local government. This is a call to the churches, to the mosque, to the NGOs, to media. This is a call to all physiotherapists, doctors, nurses, optometrists, occupational therapists, that we all have, we have to work together. It is an interdisciplinary, is a transdisciplinary, and is a multidisciplinary approach that everybody needs to work together. If we want to actually mitigate the risk that brings about frailty, and of course, thereby bringing about falls, which can also bring about hospitalization for our elderly people. And of course, when they get to be hospitalized, they start contracting this kind of different illnesses, which can also reduce their quality of life. And for the fact that they're not even doing anything, next to what they have pressure sores, and from the pressure sores, next to what infection. Infection can also, worsen into sepsis, and the next thing, this person is kicking the bucket. But can you just imagine, by we just reducing the risk factors, getting the home suitable for our elderly people, getting them the necessary assistive devices that will actually bring about safety, functional independence, and that will make them feel confident in themselves again. Getting them access to adequate screening, very prompt medical intervention, it will definitely get to help them. So it's a multifactorial intervention. And sure, you are playing your part by you bringing it to your listeners. I am playing my own role, and I think every one of us too, we need to play our role. And of course, people too also needs to know your body, because no doctor, no nurse, nobody knows your body than you do. If you start feeling funny, whereby you are leaking urine, you're feeling unbalanced, you feel dizzy and everything, please go to the hospital as soon as possible. At the moment you actually age 45 and above, please, we should start taking into cognizance our regular screening. Have a personal physiotherapist. Have your own family GP, your family doctor. Have a dietitian, on your call dial. Because food too is also something. But as I said, how many people even get to eat fruit nowadays? Sure, because fruits are expensive. It's a luxury. You want to buy, you will hear the amount, and you will like to buy an apple. To buy an apple, you'll be hearing something like about, and you'll be wondering. So the government too needs to, we need to subsidize organic food, and people need to eat because if you're saying we should eat well, but where's even the money for them to eat well? You know, it's a lot, and it's a lot, really. It's really, really a lot. And this is something that we can delve into. Just imagine in 1990, the life expectancy is 45.9 years. 2005, it went to 48 years. 2010, it went to 50 years. 2024, 56. That means on average, people are living longer in Nigeria. As what it used to be 45 years, but now it's 56. Of course, some people's, of course, it depends on actually the region and people that have access to healthcare and everything and all. So people are living longer. So, but then if you're living longer, it's not just about living, say, oh, you will live long. You need to live well. It's about living.
That's
Yeah, it's not just about living long and next thing now you are more like vegetative and you are dependent on people and you need someone to no, no, no. This is a call for everybody to wake up and we need to take our health seriously and we need to invest in our own health. And again, as another thing, again, food, you will see, like when I go to visit an elderly person, I look at their footwear. I'm only saying this on your program. Look at
yeah.
their footwear. So we need to invest in good footwear, Sheon. Like for the elderly people, we need to invest in good footwears for them. Some they've been wearing that shoe or that slippers for the past 15 years. It was always my favorite. But look at this thing, there's no grip at all, there's no friction. And next, what happens? They will just fall. And you see most of the houses now is tiles. And maybe a little bit of spill or sweat or something drips on the floor. And next thing you see them actually on the floor. Oh my God. So don't
We
let me, I
can
know,
go.
I know.
Yes, we're over the time.
Yes, it is this 7 minutes past. I'm sorry about
Yeah.
that. Mhm.
I mean, I could go on and on listening to the fervency with which you dispense this gospel of physiotherapy, and I totally enjoyed. Thank you so much for always taking your time to break it down and importantly, to give us the motivation to go in the right direction. It is good with all the calls that you have made. I think and I hope that somebody should be able to make, even if it's a teeny tiny adjustment,
Yeah,
be
just
it in
little
your
one at a
office.
time. Mhm.
Yes. And I know that over here we catch on trends really early and fast. So if a person or a company decides to remodel because they want to accommodate other people, maybe another person could. And that will be great. It will be healthy competition. And we're all having the older generation or the elderly ones not being excluded, like you rightly pointed out.
Yeah.
So thank you,
Thank you very
Muyiwa.
much,
Always a
Fusha, for having
pleasure.
me. Thank you very much. Appreciate it. Anytime.
And you can always go back to YouTube to catch up on this conversation. Please share with everyone who you think we need to have their ears on this matter because this is important. And so YouTube is at Smooth 981 FM Lagos, at Smooth 981 FM Lagos. And my guest has been Muyiwa Adejugbabe Kenneth, and he is an advanced physiotherapist, geriatrics, and frailty neuro rehab specialist. And
Everything,
everything.
Babulishi. Thank you very
You
much
can
for having
find
me.
him on Instagram at Ademoyken AD, I believe. Did I get it right?
Yeah, yeah, ADEMUYKEN 25. Yeah, that's our Instagram. That's correct. And also on
And you can
LinkedIn.
LinkedIn,
Yeah,
yes.
Adejugbabe Muyiwa Kenneth. Yeah, for LinkedIn. Just my full name.
Beautiful. And we're done for today. Next week, we'll return on Soul Food on Smooth 98.1. But in a matter of minutes, it will be the children on Curious Minds, and we'll be talking about book reading and having one of such bookworms in the studio to stay with us.
Mind, rest, volume.
Thank you.
Yeah, thank you for having me. Can you imagine? We didn't even take, and I thought I was able to call in. Oh, can you imagine? I don't.
I couldn't take messages.